There's a health condition that affects hundreds of millions of people, but for so many, it's completely silent, sometimes going unnoticed for years. We're talking about type 2 diabetes. And in this explainer, we're going to break down what's really happening inside the body, and more importantly, what we can do about it.
Just to give you an idea of the scale we're talking about, think of every single adult with diabetes. Now look at this number. Over 90%. That's right. Over 90% of them have type 2. So this isn't some rare thing, it's one of the biggest health challenges of our time.
We hear terms like high blood sugar all the time, right? But what does that actually mean? What's the mechanism? What's going wrong at a cellular level? That's the real question we're going to dig into.
So here's our game plan. First, we'll look at why it's called a silent crisis. Then we'll dive into the body's broken signal. After that, we'll talk about knowing your risk, how to take back control, and finally, why this is all about playing the long game. Okay, so Section 1, a silent health crisis. The real kicker with type 2 diabetes is just how sneaky it is at the start. In the very beginning, you might not feel a thing, no symptoms. Your blood sugar could be creeping up, but not enough to make you feel sick. And this is the danger zone, because it can go undiagnosed for years, while damage slowly starts to happen. So what's actually causing this silent problem? Let's get right to the core of it. You might think the issue is that the body isn't making enough insulin, but that's not really it, especially in the early stages. The real problem is a kind of communication breakdown, a broken signal inside your own body. And this broken signal has a name: insulin resistance. Basically, it's when your body's cells start to ignore the message that the hormone insulin is trying to send. They become resistant to it, which means they can't do their job of absorbing glucose, the body's main fuel, from your blood.
Okay, let's make this super simple with the key and lock analogy. Imagine your cells are like houses, and they need glucose for energy. When you eat, that food turns into glucose. Your pancreas then releases insulin, which is the key. In a healthy body, that insulin key fits perfectly into the lock on your cell's door. It opens right up, and glucose goes inside. Easy. But with insulin resistance, that lock gets, rusty. The key still tries to turn, but the door won't open easily. So the glucose can't get in, and it ends up just building up outside in the bloodstream.
Now this rusty lock problem, it doesn't just happen overnight. It's a slow process, usually driven by a bunch of well-known risk factors. And here's the good news. If you understand these risks, it gives you this really powerful window of opportunity to step in and do something about it.
So what are we talking about here? Well, take a look. Age is a big one, especially being over 35. Things like being overweight or not getting enough physical activity play a huge role. And then there's family history, which we can't control. Other factors like high blood pressure or high cholesterol also raise the risk quite a bit.
Before someone gets a full diagnosis of type 2 diabetes, there's this in-between stage. It's called prediabetes, and it's exactly what it sounds like. Your blood sugar is higher than it should be, but it's not quite in the diabetes range yet. You really want to think of this as a huge warning sign. It's your body's way of saying, hey, pay attention, we can still turn this ship around.
And just how much of a difference can you make? Get this. Research shows that for people in that high-risk pre-diabetic stage, losing just 7% of their body weight, which for a 200-pound person is only 14 pounds, can slash their risk of developing full-blown diabetes by more than half. That is a massive impact from a totally achievable goal.
Which brings us to the most empowering part of this whole story: taking back control. Managing type 2 diabetes isn't just about what a doctor tells you to do, it's about a whole-body approach that puts you firmly in the driver's seat. So, effective management really stands on a few key pillars. It all starts with smart nutrition and getting regular physical activity. The goal is at least 150 minutes a week. Then you have weight loss, keeping an eye on your glucose levels, and patient education, which is just about understanding your own body. And of course, modern medications are an incredibly powerful tool in the kit. And I really want to emphasize this. The power of those first few pillars, diet, exercise, weight loss, can be absolutely incredible. Seriously, for some people, making dedicated lifestyle changes is so effective that they can get their blood sugar under complete control without needing any medication at all. Now, when medication is needed, the options today are better than ever. Metformin is often the starting point. Its job is to help fix that rusty lock and make your cells listen to insulin again. Other classes of drugs can help with weight loss or even help your kidneys filter out extra sugar. Some are specifically recommended if you have heart issues. And, of course, if the body just isn't making enough insulin anymore,
insulin therapy can step in and provide what's missing.
And all of this brings us to our final and maybe most critical section, the long game. Managing type 2 diabetes is a lifelong commitment, and the reason for that is simple. It's all about preventing the serious complications that can happen after years of high blood sugar.
The number one risk is made starkly clear by this quote from the MSD manual. Cardiovascular disease remains the leading cause of mortality in diabetes mellitus. Basically, over time, high blood sugar is really tough on your heart and blood vessels. So managing your glucose isn't just about today's number. It's about protecting your heart for the long haul.
The complications tend to fall into two main buckets. You've got microvascular, which means damage to the tiny blood vessels. This is what can lead to problems with the eyes, kidneys, and nerves. Then you have macrovascular, which is damage to the big blood vessels. And that's what directly increases the risk of heart attacks, strokes, and circulation problems.
Because these risks are so serious, being proactive with screenings is absolutely non-negotiable. This means regular eye exams to protect your vision, annual foot exams to check for nerve damage, and yearly blood and urine tests to make sure your kidneys are working well. And, of course, keeping tabs on your blood pressure and cholesterol at every doctor's visit is key.
When you boil it all down, it comes back to one simple truth. Knowledge is the first step to taking control. Understanding what's happening in your body, knowing your risks, and seeing that there's a clear path forward, that is the most powerful tool you have to live a long, healthy life. So we end up back where we started, but hopefully with a totally new perspective. Yes, type 2 diabetes is a silent crisis, and it's a huge challenge. But with incredibly powerful prevention strategies and a growing arsenal of treatments, the conversation is changing. It's not just about managing anymore, it's about turning the tide.